we are not dealing with one unifying type of patients, but patients coming from many different places. And so it behooves us to know where these people from, why they need help, and how they seek help. So keep the culture alive in whatever you are doing. IPP started by Dr. David Kinsey in 77 or 78, when we had a huge influx of refugees from Vietnam, Cambodia, and Laos to America. And so that was the beginning of our existence, and our focus was mainly with the Indo-Chinese patients. But as time passed, we start to receive new waves of immigrants and refugees. So by now we are serving 18 language groups, people from not just Southeast Asia, but Central America, North Africa, East Europe, folks from Russia, and now we start seeing people from Burma, from Nepal, and some even Tibetans that we have. So at this time, even though 40% of the clinics still Southeastern Asians, but the rest are people from elsewhere around the world. By the way, including people from Middle East and Iraq and Afghanistan. The active cases that we have at this point is about 1,200 to 1,300 patients we treat on a day-to-day basis. The model that we use is to hire ethnic clinicians to take care of the patients from the same background that they're from. So we have, depends on when you look at it, 15 to 18 ethnic counselor. The biggest group, of course, is still Vietnamese, but we have clinicians from Somali, from Ethiopia. We have Farsi-speaking clinicians, Arab-speaking clinicians, Spanish-speaking, Bosnian, Russian-speaking. So that make up the clinicians group. From the very beginning, we decided that we would use a clinicians model in our clinic rather than relying on translator. What that means is that when we have a group of ethnic patients reaching a critical number, we would make all effort to hire a clinicians from that particular community, so that the patient would have someone stable all the time when they come in to seek help. And we would always pair up a psychiatrist with a particular clinicians to take care of a group of patients. For example, I'm of course responsible for the Vietnamese patients most of the time because of my language ability, but I always have the Vietnamese counselor seeing my patients. So all these years, 10, 20 years, they come in, they see the same psychiatrist, almost the same counselor, or at least the same group of counselor. The advantage is that it offers stability for the patients, familiarity for the patients, but it also allows our clinicians really know the patients for a long run and helping them out. Of course, the stability of the program. The ethnic counselor also function as a consultant for the psychiatrist at the time when the psychiatrist has difficulty to understand where the patient's coming from or what the patient's really, or behind the story of the patient, what they told us. So the clinician would help us out. Instead of relying on a translator, which is a very impersonal service in my opinion, especially in recent years, all you had someone, a voice on the phone, and there's no continuity of care, there's no advocacy to the care for the patients. We serve as liaison to the community. We encourage our clinicians to work with the leadership in their own particular community to advocate for not just the patients but families and help to promote mental health in the community, working with the leaders. We, of course, offer training to our clinicians so that they can be effective speakers on mental health topics in their own communities. When it comes to gambling or addictions issues, it involves a lot of generic education to start with. Means that the community need to know the problems, but they at the beginning would not be able to tolerate the fact that this is your community's problem. So we will start with very, very general, generic educations, and then just be patient. Build one case at a time. The important thing is that when patients come in, we're able to offer them the very particular help, i.e. solving the problems. May not be able to solve the entire gamut of problems that they have, but at least we try to show them that you come in for help, we will help you to solve your problems, even though one at a time. For example, people would come in, the first question they ask is that, where can I get money to pay back my debt? We can't loan them money, but if we can help them, and if there is a way for them to, let's say, get a loan from somewhere, or to work with family in real terms and pay back the debt, that can gain the trust from the person. But it's no easy work. It takes a long time to even get a patients to come in, and if we can show that we can help, then eventually words be spread in the community and they'll be willing to come in more so. And it's not just helping the index person, but helping the people around this person. And mostly in the Asian community, we're talking about the wives, the kids, and or the parents around this index person, likely is a male or a man. And with that, we can get the trust of the family. We can gain the trust of people relate to this person. Well, the intercultural program, the IPP here, we are part of the psychiatry department at the university from the get-go. And everyone who works here, all the psychiatrists, they are members of the faculty. And so training and teaching is part of our mission, part of our job. So all the years we would accommodate resident combine, and we will always have resident combine for rotations. More likely than not, we will have student at the different times, medical students coming for their rotations. We also accommodate aligned health professional in training, MSW folks who are looking for internships. At a time, we actually offer psych for psychology intern, but that represent a bit more problems now. Or we have had scholars all over the world would combine, spend maybe a few months, either with the psychiatry department, and then on the side would come work with us. So training and teaching has been an intimate part of our program. We were awarded the teaching award by the American College of Psychiatrists. We were awarded by the American Psychiatric Association's Gold Award. Oregon Psychiatric Associations gave us an award on the Access award, and some others. And individually, at least two of us, we were awarded the APA Asian American Psychiatrist Award at different times, of course. So yeah, this is a well-recognized program, and I would like to say well-respected program around the country at least. But just look at the current faculty, for example. Dr. Bainline, he was trained in our program and then later on became a member of the staff, and he was the president of the Society for the Study of Psychiatry and Culture for close to 20 years until recent years. Dr. David Kinsey, well recognized, not just in America but around the world for his cross-cultural work, has been with our clinic for all these years. I have been on the board of the Pacific Rim College for a few terms, and also at the Society for Study of Psychiatry and Culture. So as an individual psychiatrist, we do have very close contact with the cultural psychiatry world. People who done with our training and went on, including people like Dr. Laurie Moore. She went to New Zealand and Australia and become a prominent community psychiatrist there. So there are names that we may need to go back and look for. But the thing about our program is that majority of the residents who came through our program and then after done with training, majority of them still involved in community mental health, not just in Oregon but elsewhere, depends on where they ended up. And so that's the purpose, is to train psychiatrists who are community minded. Not only they can work with the mainstream but also work with ethnic patients. That actually is the goal that we have in training people. Yeah, it makes IPP for prominent or well-known or well-respected. I think there are several reasons. I think number one is the group of psychiatrists work at IPP. Majority of us, we have stayed in not for years but for decades, and all of us affiliated with the psychiatry department, and so training, research, and services are the three things that we value the most. And so not just to provide the best patient care that we know of to our ethnic patients, but train people so that they can be comfortable in doing that, as well as continuously involved in research to stay at the edge of our trade. But the other reason that the program is respectable, of course, is the reputations that we earn from taking care of our patients with the help and assistance of our ethnic clinicians. So in refugee and immigrant communities, the importance of name is you just cannot ignore. So you can take care of 10,000 patients. No one necessarily will come back to say thank you. But if we really mess up with one, it will be known all over. So that is also very important. So consistency and persistency in serving the patients, as well as education, I think those are the reasons that we have earned our respect. So for the young psychiatrists who have just entered into the field or about to go out and practice, I think the advice is just keep your mind open and keep your curiosity, and keep in mind that in psychiatry, just like in medicine, we are not dealing with one unifying type of patients, but patients coming from many different places. And so it behooves us to know where these people from, why they need help, and how they seek help. So keep the culture alive in whatever you are doing. And so I think that'd be my advice.